Welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I'm Angela Yarborough, and this is Dr. Jerry Yarborough.
Hello.
What are we going to be talking about today?
So today we're going to be talking about back pain, but even more specifically, sciatica.
Sciatica. What is sciatica?
Well, sciatica is a common medical term for pain that runs down your leg.
Oh, yeah. I have had that before.
Yeah, me too. Okay. Yeah. But specifically today, we're going to be talking about one of the most common causes of sciatica, which is disc herniations, or a bulging disc. Okay? So just a quick anatomy background is our spine is made up of about 32 bones called vertebra, and in between each bone we have a cushion, which is called a disc. And either as we age or as we put undue stresses on our disc, they will sometimes herniate or bulge. And actually 80% of the population actually have bulging discs. Now, not that whole 80% are affected or, it causes pain, but actually 50% of adults every year are going to experience some pain. And many of those are going to, miss doing work and all. So anyway, so we're going to focus on the cause of sciatica from disc herniation. So as that herniation or that bulge occurs, in between each bone we have a nerve that comes off, and it will innervate in our lower spine, either our low back or down our leg. And whenever it pushes on that nerve, that sends a signal down our leg. That's how we can have pain going down our leg, which is caused from a herniation in our lower back. And so what we're going to show you next is 3 good exercises you can start doing at home if you exhibit pain that could be caused from disc herniation. And you're typically going to know that it may be a disc herniation if the pain is increased when you cough, sneeze, twist, or bend. Okay? So let's get on to these exercises now and show you what to do today. Okay, so we're talking about sciatica caused from a disc bulge or herniation. So anytime that you've been sitting for a while, or lift anything heavy, or just having some lower back pain, you want to start off with some standing lumbar extension. And this is Dr. Jessica Clark, and she's going to demonstrate for us. So standing low back extension, like that. Okay, just hold it a few seconds. This will normally feel good. Okay, do it about 10 times or so, and that should help decrease some of your pain. What that's doing is help pushing that disc kind of back in place. And we're going to show you 2 more. If you lay down, the first one is what we call prone on elbows. So you're laying on your tummy, and you're going to come up on your elbows, leaving your pelvis and your low back in position. Do not raise them up off the bed or mat, okay? And from there, when you can do that without significant pain, you can advance it to prone on hands like that. And you're going to try to hold that as long as you can, up to about a minute if you can, and do that about 10 times. And that will help significantly decrease your low back pain and sciatica caused from a disc bulge. All right, if that doesn't help, give us a call. We're always here to help you at Fyzical Therapy and Balance Centers.